So here we are in winter, and yet again the news is full of stories about how the NHS is failing and not working and overwhelmed. It's every single winter. It's all we ever hear about. And I don't see the same articles about the health system in France or Italy, never in Norway or Denmark or Sweden or anywhere like that. It's just in the UK. And yet people still revere the NHS and think it's perfectly fine to spend the budget of a small country. The NHS is broken beyond belief. It's based on a structure and a strategy for something that no longer exists. You know, we're in a different place 80 years or however long it's been since the NHS was put together. And I've said many times that the largest reason, in my opinion, is because the population now is so much bigger compared to when the NHS was designed. That is also the reason why we lose lots of well-trained NHS staff to places like Australia, which I've mentioned before. It's not about money. It's about the fact that here they are overwhelmed with people. And if they go to Australia, which is 32 times the size, yet only has the population of Scotland, like 5,000 or something, they have a better quality of life. They don't have a corridor full of patients outside waiting. They can get to spend time with their patient, get like work satisfaction, and give the care that they want to give each patient. It's about numbers. That is one large part. Then you have complete mismanagement of funds, and it's gaslighting beyond belief when they keep asking for more money, and yet every day I hear from people I know in the NHS of courses that people are getting sent on to do flower arranging or something idiotic for well-being or something. And you see adverts for diversity or net zero roles that are all at, 80 grand or some crazy high salary. I don't know what they do every day. None of it's rocket science. We need central purchasing for everything where possible to get the lowest prices for the NHS. The population needs to be looked at so that the NHS can manage the demand. And it's like filling a bucket with lots of holes in the bottom to keep saying, well, we'll bring more people in to cope with the demand. We'll bring more people in to cope with the demand. Doesn't work. And the waste is huge. So like I've said many times before, I've worked amongst the NHS in a sales role, and I would see whole wings being built that unfortunately weren't going to be for patients, or it was for admin staff and managerial staff. You don't need loads of admin and managerial staff. We need to cut the paperwork massively and then get rid of all this administration and all the staff corresponding. There should only be a small amount of top level factual need to know data that nurse doctor can fill themselves in a small amount of time, and get rid of all this paper pushing nonsense and all these managers, and just have your matrons on wards. You need to stop Tony Blair's thing about having nurses having degrees. Just get them back to working on the job, learning on the job. And then you need to, as I've said before, getting a place on a medical degree is so hard. And particularly if you're a white student, unfortunately, you're battling for a small amount of places under the DI divisive policies we currently have in this country. You need to make it easy for really bright students who want to do medicine to study medicine, and you need to make those courses free. And you need to tie that in with a proviso they work for the NHS for 20 years. 20 years goes fast. That's perfectly acceptable in my opinion. You then need to get rid of the waste that I've seen, where they would contract out cleaners at extortionate kind of payment levels, or people that would come in to fill hand sanitizer bottles like for £10 per bottle, like crazy numbers. No one cares because it's somebody else's money. I've seen marketing budgets that are astronomical, and they happily throw away leaflets that have been printed to the tune of tens of thousands if there's been a small change they want to make. I've seen builders being told to up their invoices because they want to increase the budget they get next year. There's so much incompetence, so much waste, and lack of accountability. We need to charge people that are from abroad using the services. We need to get a lot tougher on the amount that's spent on all of that, and interpreters and everything else. And we just need to get back to the basics of doing what they need to do in caring for patients. And, you know, we seem to have less beds every year, which is why we have less availability. We also have Tony Blair. Again, he was the start of all the problems, like I've said before, increasing the salaries of GPs astronomically. So many retired or went part-time. And then he also cut their hours so they didn't do evening or weekend work. So that all went to A&E to deal with. You know, again, my grandparents would have a family doctor that would come to the house whenever you wanted. When I was little, doctors were open evenings and weekends. Now they're not. And they're also closed all the time for training, bank holidays. I mean, the services are getting less and less and less. Like we're constantly seeing for our money, we're getting less and less and less. And there's more and more people for that increasingly inadequate service. Like everything in this country, none of it's rocket science. Just needs people with a brain. And all this woke, all this DEI, all this regressive stuff that holds us back from making the differences quickly and swiftly, that all needs to go. And like I said, bring everything in-house. All the cleaning should be in-house. Cooking and purchasing meat and vegetables from local suppliers. It's all really simple, and it could be done tomorrow. But we need people with those ideas, with the will, with the capability, and you'd see it all change very quickly. It's the same with everything. Just need the people with the will to do it.